Each year in America, approximately 150,000 new cases of colon cancer are diagnosed. At the same time, this disease takes a terrible toll, as it takes the lives of over 50,000 people in our country every year. Many say that colon cancer is almost an epidemic, and indeed, looking at the data that I have provided you with, it must be stated that this disease is a real and at the same time extremely dangerous plague. However, colon cancer is a curable disease, although it must be admitted, and I think it will not come as a surprise, that the earlier it is detected, the greater the chances of recovery and a longer life. So I will now explain how to detect colon cancer at an early stage, what symptoms may indicate that we are struggling with it, and what is it about our lifestyle that causes us to get it in the first place. Let's start with the issue of early detection of colon cancer. Well, I expect that some of you would now like to hear which early symptoms may indicate that we are struggling with this cancer, which signs should worry us and motivate us to go for a more in-depth diagnosis. However, I do not have much to say on this issue because in most cases, there are no early symptoms of colon cancer. What I mean by this is that most often, the first stages of development are completely asymptomatic. In turn, the symptoms that we often read about as indicating colon cancer appear only in patients with advanced cancer processes. This means that even if we don't see noticeable symptoms, cancer can still develop in secret. Naturally, the question arises, what can be done and when to detect colon cancer at an early stage, which would significantly increase the chances of recovery? In general, the gold standard for diagnosing this cancer is colonoscopy. This is the only test that allows us to determine with 100% certainty whether we are struggling with colon cancer or not. Moreover, based on colonoscopy, we are able to detect colon polyps. I will just briefly say that these are certain growths that form on the inside of the intestine. They look like small bumps or protrusions and can have various shapes. I mention them because some polyps may develop into colon cancer in the future, which is why they are sometimes called potentially precancerous lesions. This particularly applies to so-called adenomatous polyps, although it should, of course, be noted that not all types of polyps turn into cancer. In any case, I would like to say that during colonoscopy, doctors very often remove polyps. This can significantly reduce the risk of developing colon cancer in the future. The question remains, however, when should a colonoscopy be performed? Well, in many countries, there is a colon cancer screening program which involves performing a colonoscopy. It is aimed at people aged 50 to 65, and, in my opinion, as well as many different specialists, being 50 plus is worth doing the mentioned colonoscopy. I would also like to add that people aged 40 to 49 can also benefit from this program if their closest relatives have been diagnosed with colon cancer, as this may indicate a certain genetic predisposition. And let me emphasize that we are talking about people who do not experience any disturbing symptoms. I would also like to emphasize that this program is completely free and does not require a referral. All you need to do is report to the facility that implements it. As a curiosity, I will also say that I found information that if we have a case of colon cancer in our immediate family, we should have a colonoscopy 10 years earlier than the age at which the cancer occurs in the family. If, for example, our parent was diagnosed with cancer at the age of 52, it is a good idea to have the first colonoscopy at around the age of 42. However, I must admit that few people use this program. I think this is due to the fact that, in general, preventive examinations have quite little interest in our country. Secondly, many people are afraid of the colonoscopy itself, if only because of the pain that may accompany it. However, I would like to point out that if there are indications, this examination can be performed under local anesthesia or general anesthesia. It is definitely worth encouraging every person over the age of 50 to do it. You may be wondering if there is a good, less invasive alternative to colonoscopy. Well, as I said, if we want to be 100% sure that we are developing colon cancer or that we are healthy, the only thing left for us to do is have a colonoscopy. However, if for some reason someone is very reluctant to undergo a colonoscopy, there is one more test that is worth doing. It is a test for occult blood in the stool, blood that is invisible to the naked eye. But be careful, because there are several different tests for occult blood. The best of them is the so-called FIT test, or immunochemical test. Unlike many other tests, this one is the most precise and only evaluates blood from the lower gastrointestinal tract, such as the large intestine or rectum. This ensures that the result is not affected by blood from other parts of the digestive tract, including the stomach. Overall, the FIT test has several significant advantages. First, you can do it yourself at home and send a stool sample to the laboratory. Secondly, its performance is not associated with any complications and does not require a special diet or discontinuation of medications before the test, unlike older tests. Due to the fact that performing this test regularly, for example once a year, usually allows for the detection of potentially disturbing changes relatively early, many specialists encourage the FIT test as a screening test for the diagnosis of colon cancer. And if the test result is positive, when the presence of occult blood in the stool is detected, only then should the patient be referred for a colonoscopy. Therefore, if any of you are reluctant to undergo a colonoscopy, which I encourage you to do anyway, then it is absolutely necessary and worth seriously considering taking the FIT test, taking into account the fact that in recent years we have observed an increase in the incidence of colon cancer among younger people. The authors of some scientific papers suggest that people should perform the FIT test periodically, starting from the age of 35. What I mean by this is doing this test once every year or two. In order to maintain the reliability of the material, I must emphasize that a positive result does not automatically mean cancer. There are several other reasons why small amounts of blood may be present in the stool and may cause the result to be positive. I am referring here primarily to the presence of hemorrhoids and colon polyps, as well as inflammatory bowel diseases, especially ulcerative colitis, but also Crohn's disease. At the same time, I must emphasize that the absence of a positive FIT test result does not exclude the presence of colon cancer, especially in the early stages. As I said, this test is a useful screening tool, but it does not fully replace a colonoscopy. Now that I have explained what are the best ways to detect colon cancer early, I would now like to briefly discuss what symptoms may indicate that we may be struggling with this disease. Although, as I mentioned, they usually appear in a more advanced stage of cancer. Moreover, I must also add that these symptoms are quite non-specific and can often be attributed to other diseases. One of the symptoms that may indicate colon cancer is the visible presence of blood in the stool. It may be visible, for example, on toilet paper after a bowel movement, as well as on the outer surface of the stool, or as a streak of blood mixed with mucus. And here I would like to emphasize that the presence of visible blood in the stool is always an absolute indication for further diagnostics, such as colonoscopy. However, we often downplay this symptom and attribute it, for example, to the presence of hemorrhoids. The presence of blood in the stool in cancer is due to the fact that the tumor growing in the intestinal wall destroys the mucous membrane and damages small blood vessels. In addition, the movement of fecal masses through the intestine at the site of the tumor may cause additional irritation and micro-injuries, which result in bleeding. Another key symptom that may indicate colon cancer is a change in bowel habits, especially when the problem has been present for a long time, and there is no other obvious cause, such as a change in diet, stress, or intestinal infections. This refers to recurrent constipation or diarrhea, or alternating occurrence of both conditions. I will briefly explain why this is happening. Well, a tumor growing in the intestine narrows its lumen, making it difficult to move fecal masses. This causes constipation, which may be chronic or recurrent. In response, the body tries to push the intestinal contents through the narrowed space, which can lead to diarrheal bowel movements, which result from the overproduction of fluids by the intestinal mucosa and increased peristaltic movements of the intestines. Therefore, a persistent change in bowel habits, especially in people over 50, is an alarm signal that requires further diagnosis. Speaking of bowel movements, I will add that another symptom that may indicate colon cancer is narrowed stools, or so-called pencil-shaped stools. As the name suggests, the stools become thin and resemble a narrow cylinder or pencil in shape. This is caused by what I mentioned earlier. The growing tumor partially blocks the intestinal lumen, which causes a significant narrowing of the space through which fecal masses can pass. The intestine, trying to push fecal masses through such a narrowed place, simply causes them to be compressed. This symptom is more typical for cancer that is located on the left side of the intestine, in the area of the descending and sigmoid colon. Other symptoms of colon cancer include, of course, abdominal pain, which is usually dull and often located in the lower abdomen. This is because the tumor irritates the intestinal walls, causes obstruction, or presses on adjacent tissues and organs. However, such noticeable, persistent abdominal pain is often a rather late symptom and often indicates an advanced disease. Additionally, bloating and a feeling of fullness may occur, although this symptom, as you can probably guess, is not very specific and can be attributed to many other ailments. In addition, in the course of colon cancer, we often observe unintentional weight loss because the tumor activates processes leading to the breakdown of muscle proteins and fat. It also releases pro-inflammatory molecules that disrupt our metabolism, and what's more, sometimes hinders the absorption of nutrients from the intestines into the bloodstream. Another sign of colon cancer may be anemia, which manifests as pale skin, chronic fatigue, dizziness, heart palpitations, increased brittleness of nails, and hair loss. This is for the reasons already mentioned. The growing tumor can lead to microbleeds and blood loss, and it can also interfere with the absorption of nutrients, including iron, vitamin B12, and folic acid. In very advanced stages of colon cancer, pain in the right upper quadrant, jaundice, shortness of breath, and chest pain may appear because the cancer most often metastasizes to the liver and lungs. By the way, if any of you would like to contribute to the development of our community on this channel, all you have to do is click the subscribe button under the video and then the bell that will appear next to it. Now that you know how to detect colon cancer early and what symptoms may indicate its presence, I will briefly explain why we as a society struggle with such a high incidence of this type of cancer. I will also mention that, according to the professional literature, about half of all cases of colon cancer can be prevented through an appropriate lifestyle. In yet another publication, experts wrote that dietary factors are responsible for as many as 70% to 90% of colon cancer cases, which means that how we live our daily lives has a huge impact on the risk of developing the disease. One of the most important causes of colon cancer is too low an intake of fiber in the diet. In the case of a diet low in fiber, food moves slower through the intestines, which prolongs the contact of the mucous membrane with potentially harmful substances that promote the development of cancer. In addition, fiber produces short-chain fatty acids that have a protective effect on the intestines, including preventing damage and supporting regeneration. Studies have shown that people who consume a lot of fiber have an average 26% lower risk of developing colon cancer. Another dietary factor that promotes colon cancer is highly processed red meat. According to scientists, frequent consumption of it increases the incidence of this cancer by an average of 21%. This is due to the fact that high temperatures during long-term frying result in the formation of carcinogenic compounds. It is also unfavorable to consume low-quality sausages, hot dogs, and hams. Personally, I believe that there is no need to completely give up, for example, fried meat, but it is good to partially replace it with fish and poultry. In the scope discussed and beyond, products rich in sugar, mainly sweetened beverages, are also enemies to our health. In a recently published study, its authors indicated that frequent consumption of sugar-sweetened beverages increases the risk of colon cancer by 17%. Next, we have alcohol abuse. Researchers noted that drinking 4 servings of alcohol a day was associated with an increase in disease incidence by as much as 50%. When it comes to factors contributing to colon cancer, it is impossible not to mention excessive food consumption, which leads to overweight and obesity. In one scientific paper, I found information that approximately 11% of all cases of colon cancer in Europe can be attributed to excess body weight. According to epidemiological data, obesity increases the risk of this cancer by up to 70%. In addition, colorectal cancer is also promoted by smoking, which increases incidence by 17%, as well as a lack of exercise and a sedentary lifestyle, which increase the risk by 21%. Furthermore, people aged 50 plus, patients struggling with inflammatory bowel diseases, people with polyps, and those with a family history of colon cancer are more predisposed to developing the disease. As a curiosity, I will also say that there is such a thing as Lynch syndrome. It is a hereditary genetic disease that increases the risk of developing, among others, colon cancer, and is associated with mutations in genes responsible for repairing DNA, our genetic material. It is very common for people with Lynch syndrome to develop cancer before the age of 50. If your immediate family has been diagnosed with cancer before the age of 50, mainly colon cancer, but also liver, pancreatic, stomach, prostate, ovarian, or endometrial cancer, this is an indication for genetic testing to check whether you may have Lynch syndrome. As you can see, colon cancer is a serious problem that more and more people are struggling with, including young people. That is why I once again strongly encourage you to take preventive tests when the right situation and time come, and, at the same time, not to ignore the symptoms I mentioned today, especially if several of them occur at the same time. That's all from me for today. Thank you for watching, and see you in the next video.